As usual, like I said, I don't use any oil. This is a little muscle rub. And sometimes I'm apply, sometimes I don't. It depends on person. If person have a dry skin, I do it. But yeah, this is probably how much I put it. It's good. It's CBD on it, and this is great product. So I'm just apply on the top of the foot, and what I'm looking for, first thing first, I want to see if any movements between those toes. So I see the movements here. So what I'm doing here, I'm holding, metatarsal. I'm holding the fifth one and the fourth moving. I actually have to start with the big one, but I like to start with a pinky. So come grab the fourth and third, moving, see any movements. Now I come in up here, the third one and fourth, and it's not a lot of movements up there. All right, so now the big one and fourth, the fifth one, and it's good movement. So what I'm find out, this area right in here, it's a little bit kind of limited. And for some people, you will find out that the whole foot is just like a stone. And people say, my lower back is hurt. Why? Because it's that's like a springing system. It's like not your shocks in your car. You know, if it's a shocking system is bad, the whole stereo wheel is going to be bad. Same in our body. If your ankle is don't have lost that function, the whole leg is going to be suffer. Knee, hips, and it's go all the way up to our head. Yeah. So slow, don't rush yourself. And she's extend. And I feel a lot of stuff up here. And when I came close to that knee, I'm sliding from the midline to the lateral. And that's the key. So again, 2 thumbs together, gliding down. You can do single leg. You can use the thumb, like a tuning fork, sorry. And all you do, relax. If person can't do that kind of movements, you can use the band. You okay?
No, just,
what is it? Sore?
No, it's not soreness. I don't
Explain it. Because we move faster, and that's what you're feeling. Another one, if person, like I said, can move, you can get the band to help yourself. If not, you can just help him. You see, I usually grab that heel just like that. My forearm is right here, and all I do just lean and back, lean and back. You can use the other arm. So for the video, this is probably going to be the best one because I don't want to kick that camera. That's why I'm kind of see and release. So you pull this way. Yeah, she's got a lot of stuck up here. So what I'm going to do, I'm going to go my usual speed because I want to help her. I want to release that. Yeah, if you do massage, you just apply the oil, probably doing this, and nothing happened. Person is the same. They feel good, your blood circulation, maybe you get some renew the skin a little bit, remove that, that skin layer, but that's probably about it. And you spread some Chinese oil, which is probably like cheap stuff, and it's going to penetrate in the skin and not good. So this is how I do it. You can ask her to move, and down. And I can feel that. Slowly, 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 slowly. I found a lot of stuff. Like I said, if this is big leg, I like this one too. The 2 thumb, they navigate you over that tibia bone, so you're not pushing too much. This hands, the tibia right between those thumbs, so it's like this. You see, it's beat between, and all I do, my body weight, and this is my favorite one. So I lean, and that's it.
This is good for runners.
It's great for runners. The front line is great for everyone, for office workers and runners. Here we go, right there. You see, she feel it. Now I feel like a good bump up here. A lot of stuff going on up here. What I want to do, I want to work a little bit deeper. So what's the call? Fancy schmancy. I'm sit down, I'm relaxing. I use my forearm. I've never used the elbow. I see people a lot of use the elbow. You can if you use that soft tissue, this muscle right here. If you don't have, if you're a bony person, just try to be gentle. So what I'm doing here, I hook that fascia. You see, I'm moving the whole body. If I move, her whole body is shaking. That's mean I hook her fascia. And what I'm doing here, ask her to take a deep breath, and I'm start gliding down. I mean up. Let me. And this is my speed, very slowly. The people love the quadriceps work slow because if you go so fast, it's super sensitive. And I found like a very tense spot up there. I ask her to breathe and exactly let it go. And as you can see, I'm a little bit rotate my elbow. Rotate my hands because I don't want my elbow be in the midline. So it's kind of go away. And what I'm doing here, I go all the way up to this anterior iliac bone. So right there. Like, you feel it?
Yeah.
Yeah, don't go. And here we go. All you need to just to hold it. She don't need to raise like right now, but you just get some time. If you guys not sure, work couple spots and you should be fine.
Yeah, I can feel.
Okay.
Sometimes I move it around. Like
Yeah.
Passive, I do passive.
Yeah, you can do passive too, but like I said, I'm lazy, so I'm not doing passive anymore. I used to do passive. No, I do a lot of passive, but yeah, this one, look, this one pops up more. And what else you see? What else you can see?
It's
How she's breathed. Remember the breath 360?
Here,
the-
from chest.
Yeah.
But
The baby breath. Remember when the baby born, the baby extend sides up, this way, and superiorly. Now, take one more breath. You see the energies go always up, always this way, and this one is restricted. This is actually very good stuff to work on. But navel, I found the navel, across the navel, I get to my fingers, and all I do, I kind of like working, you see, gliding my fingers up. All the way up to the rib cage. I'm not pushing that xiphoid process. I don't want that. It's really painful. Not painful, it's just, it's going to be not super beneficial. And if you want to go a little bit deeper, you apply a little bit pressure down more and you scoop up. So you pull that fascia up. You can do single side, you can do top if you want to start breathing, and I slide my hand up. I can use 2 fingers, 3 fingers. Like I said, if the chest on your way, ask the client to pull chest to get that sternum area, midline.
helps for diaphragm.
Exactly, it's for everything. And I come up here, and I go all the way, and I do one more time. Yeah, very slow. And that's about it. So here, I'm switch, and I came from here. I am gliding my hand, my fingers up. So guess what I'm doing here? The most people collapsing in this sternum, right? Now, I hook that sternum, and I pull everything up this way, right? So that's movements help a lot. With this douch hump, like we've been talking last time, this is help. And I'm just gliding down, you see, and she's do the work. And and I come more. You see behind the ear all the way up and release. Return to the neutral position. Let me show you. David is left. Okay, go ahead, start rotated. And you see, how's it feel?
Good.
It feel good. You see my hand is straight and I'm gliding down. Let's wait for, let me work on the other side too. David, They don't want to learn. That's all right. So now we're gonna. That was the front kinetic line. Like I said, it's so many variation of working on that kinetic line, but idea is no oil. Catch that fat, like pull that fascia, find those muscles. Especially, don't forget to work on that pocket of the in the quadriceps muscle. Very important. Working on that abdominal. See how that the diaphragm are rising. Is that equally? Is not. So pay attention to those details. Like I said, don't rush yourself during the treatment, and you should be just fine. How I finish the session, I always do spine decompression. I grab the neck, pull. I'm already showed this many times. I can work a little bit on the neck, do rotation. For the lower back, I'm doing this. I grab both heels. Also, I check my hips. So I put the fingers on malleoli, see if they're leveled. It's going to be different class. I grab those heels, pull. I lean back. You see I'm lean. I can shake her up a little bit. It's called dolphin tail. Pull, hold, you see, and release. So that was the front line. Now we're going to do a posterior line on Laura. Okay. Thanks for watching, guys. Next class is going to be lateral kinetic line, how we work lateral. It's going to be side position and also good stuff. Okay, let's work on Laura.